Welcome to the World Federation of Hemophilia panel discussion on the changing landscape of hemophilia care and what does it mean for patients. We have a very distinguished panel. On my left, Dr. Jerry Powell from the University of California at Davis. Dr. Powell is a Center Director at the Haemophilla Treatment Center. Dr. Johnny Malangu, who's from Johannesburg, South Africa, also a Center Director in the Haemophilla Treatment Center. And Dr. Alfonso from Hamilton, Canada, McMaster University, also a Center Director. On my right, two very experienced people with hemophilia. Brian O'Mahony at the end, who has severe hemophilia B, and Mark Skinner, who has severe hemophilia A. So my first question I'll actually direct to Jerry Powell. So the first longer half-life factor 9 concentrates has just been licensed, the first one. And a longer half-life factor 8 is expected this summer. Other products will follow in the next few years. So how do these new products differ from those that we've come to know and love over the last few decades?
There are some similarities. They are safe and they're effective. So safety is always most important. They're clearly safe. That's very reassuring. Effectiveness is defined in two ways. One, if you have a bleed, you want to stop the bleed, stop the pain immediately. So these new factors are as effective at stopping the pain of an acute bleed immediately. There's no question about that. What's different is that they have a longer half-life, which means that you can maintain your factor level at appropriate levels for your level of activity for much longer with the factor 9 than any current factor 9 product available. And that translates into two major benefits. One is fewer infusions, and two is a higher trough level, so you're less likely to have any spontaneous bleeding and less likely to have any bleeding with minor activity.
I'll address the next question to all three of the physicians. Perhaps we can start with Dr. Malangu. So how do you see these products being used? Longer half-life, we've heard about trough, also less frequency. So how might prophylactic regimes change when these products are introduced?
Well, there are a couple of advantages of the new products, and I think most of us who are working in the field of hemophilia have accepted now that prophylaxis is the standard of care. And what these products are likely to do is to increase our uptake of prophylaxis, and that is very important. As you know, even in fairly well-resourced environments, the uptake of prophylaxis has always been low. And it's largely because of the inconvenience of frequent dosing. So I think that is perhaps the most important contribution of the longer-acting products.
Could they also be used in on-demand treatment?
They could. Again, we don't need very often a second infusion even with the current concentrate, so there's no necessarily need of a second one, but there's no reason to expect that if you can have a longer therapeutic level with a single infusion, you might not want to use it. And that's for sure an option. I agree that possibly the gain of having a different set of tools will increase our capability of finding for each one the best possible treatment.
My next question to the patients: how do you see these longer half-life products affecting quality of life?
I think they have the potential to have a fairly major impact on quality of life. I think we're going to see a situation, in my view, where we're going to see individualized therapy. The day of everybody with factor VIII deficiency possibly be put on 25 to 45 IU per kilogram prophylaxis, same regime will change. They'll be looking at each individual's quality of life, their bleeding pattern, the amount of joint damage they have, what they want from treatment, and they'll be altering it in relation to that. I think so. Quality of life, I think they have the potential to make a significant contribution to better quality of life. Jerry is nodding his head. You don't agree?
So I don't, I'm going to object, if I may. The word potential suggests that something's not been demonstrated. And we have several clinical trials. They're the largest clinical trials ever in hemophilia. And at the end of the clinical trial, every individual subject with hemophilia B was given the choice: continue with the extended half-life product or go back to something like they had before. And none 150 on one study, 130 on another, 110 on another. That's over 400 patients chose not to go back to the current therapy. They all chose.
So why did they choose that? Because of
They all
less
chose not
frequency
because of a
or better-
potential for
better
quality of
outcomes?
life.
Because of the real benefit.
Yeah, it's
What
not
was the real
potential.
benefit?
It's been demonstrated in over 400 people for over a year. They all recognize the benefits. So I would say not potential, but proven benefit.
Didn't they have the same annual bleed rate as with previous products in
I think
clinical trials?
The most important criteria for improvement of quality of life is what the individual patient chooses. And I'm saying that there's over 400 patients who recognize the proven quality of life improvement with the extended half-life products, and they all stayed on it.
It's only potential because it's only a real improvement in quality of life if you can get access to the product. That is not guaranteed. The economics are going to play a major role there. And I know you have a different view, Joey, and I heard you saying earlier that every patient should get what they want, when they want, and how they want. I like that, but it's not realistic. The funders are going to have a role here. So it's only a potential improvement in quality of life if you can actually get the product. What about a patient who's currently on a clinical trial, who's on an extension study? He's very happy with his quality of life improvement, and then the government decides when it's licensed, I'm sorry, we're not going to have that product available in this country, it's too expensive. What happens then? His quality of life is diminished again.